started off as a one-panel thing. It was just supposed to be one panel, nice little breakfast, a conversation, little mini reception afterwards. And then it became this amazing, elevating Black women, talking about policy, leadership, and all things that we know going on right now. I came to the Black Women's Health Imperative as an undergraduate student, pursuing my health education degree. I knew that something was going on. I lost my mom prematurely. I lost my grandmother prematurely. These are Black women that didn't make it out of their 40s into their 50s and to see it. And I knew at that time I had to take control of my health. And so that's what I was able to do with the Black Women's Health Imperative. Because I was able to also do work that I could also see myself in, but then also advance professionally. So that's what brought me to the work. Yeah. We're trying to figure out how can we make change any way we can. And I think some of the barriers to that is just how people see movements in themselves. They may not see themselves in it. And so that's so important for us to show young people, no matter what you're doing, no matter what you go to school for, you can go to school for communications, you can go to school for architecture, you are a part of the reproductive justice movement because you have a lived experience that is collective to the action that we need to take for change.
A lot of times when people think of social justice work, they don't necessarily think about reproductive justice work. So we've seen galvanization around Black Lives Matter, justifiably so. The last election was a racial reckoning around George Floyd and Breonna Taylor. This election is much more of a referendum on reproductive justice, but we haven't necessarily seen the galvanization of that being a motivating issue. What strategies do you have to mobilize young voters at that intersection of social justice and seeing reproductive justice as part of that?
It's bringing the relevance of a key issue like reproductive justice and really educating our young people on what is it? What is the movement? What is the work that needs to be done? And kind of bridging the gap, because like you said, they understand kind of the legacy social justice issues. They know the attacks that are on voting rights, but getting them to make those connections around the loss of our bodily autonomy, the broader efforts to control our healthcare decisions. And honestly, for a lot of our, college freshmen, it's like, oh, they get it. Because they're like, well, I just came from my parents' house where, they controlled where I went, who I saw, all of that. And so honestly, sometimes it is literally taking it down to something as understandable as that. So yeah, it really is kind of that education piece and ensuring that they have a strong foundation of the importance of, being engaged and activated around issues like reproductive justice that are on the ballot in more ways than one this November.
What we tell our students within the Next Generation Leadership Institute is that you can be a conduit of change on your campus, and you can build and sustain that momentum into a larger movement. But it all starts with where you're at today. So my biggest word of advice is starting where you're at.
Storytelling is a huge part of the work that we do because not only is it for program, but it's for policy, right? We need people to tell their stories when we're meeting with folks on Congress, right? We need them to know that this has an impact on the daily life of everyday Black women. And so I start there. Tell me your story, because I'm gonna tell you mine.
There you go. We have a campaign that we call is Sick and Tired of Being Sick and Tired. It's our Sick and Tired campaign.
I know that's right.
And so part of that has been around the expansion of Medicaid. The majority of Black people live in the South. And so our work is rooted in the South. Part of our work is twofold. One is around this idea of how policy impacts our community and why we need to get engaged in policy. The other part of our work too is around power building. How does that connect? Fundamentally, we also, sisters, got to shift the paradigm of who we are and who we think we are, right? Because we have been raised in the belly of the beast to believe that our value is what we produce. And we believe that as well. We believe that the busier that we are, the more people that are pulling from us. On one hand, we complain about it, but the other hand, it makes us feel needed and valued, right? And so we've attached our value, which has been very similar. And so Black Voters Matter, part of our work is one, it's around power building to get Black women in particular. We're not trying to convince people that it's the vote that matters. We're trying to convince Black folks that Black folks matter and that the vote is one vehicle for us to be able to access power by shaping policy and putting people in office that align with our values and taking some folk out, because there got to be some consequences. When folks come after us, Like, there has to be consequences. When you're having maternal mortality rates in Georgia and other places that rival developing countries, you've got infant mortality rates that are high, and then we got folks that have the audacity to act like they care about unborn children. Like, you don't even care about the children that are here. Shut up.
Hello. Hello, somebody. And to extend that, I think that rest is a form of liberation. Absolutely. For you to have so much agency over yourself, for you to be able to say, no, not today, that's a form of liberation. Linda, if you could talk a little bit about standard of care. We have this conversation about standard of care, and we talk about what that means. But can you talk about it as it relates to Black women, and what does that look like?
There's been research that's been done that dictates what kind of care people should get under what circumstances. The problem is Black women often don't receive the standard of care. And when we talk about evidence, so we're applying evidence-based medicine or therapeutics, well, we are often not included in the creation of that evidence, so we don't have any reason to believe that that evidence applies to us, and we saw what happens when it doesn't. During COVID, pulse oximeters didn't work as well on people with dark skin. Dexamethasone wasn't as effective on African Americans with advanced disease. Why? Because we were not included in those clinical trials. Take cervical cancer, there's the HPV vaccine. Well, Black women have a different response. So the 2 strains that are most responsible for cervical cancer for Black women are not included in the vaccine.
Oh, wow.
Because there were no Black girls in the clinical trials. Oh, wow. So it's important because we know if Black women could get the standard of care, if Black women knew that when we talked about evidence-based medicine, that evidence applied to them, then we could make real progress. But that's not where we are. And the reason that is because the way systems are set up, the way care is delivered, the way healthcare is organized, does not center or prioritize us. When you think about research, less than 2% of NIH-funded researchers at the highest level are Black. The percentage of Black physicians has not changed in 40 years. So the people we see who are going to take care of us typically don't look like us. And if we can't figure out how to get the systems organized to deliver care to us the way we need it, then we'll never get there. So we've got to look at the power structures, we got to look at racism, we got to look at gender discrimination and income inequality, because at the end of the day, those are the determinants of health. Not housing, not transportation, not food. All of that's important. But if we can't expect to get the standard of care, then we can't expect to be healthy.
It's important that the candidates that we endorse, we make sure that they stand on business, right? We endorse you for a reason. So ensuring that, when they are introducing bills, that the findings that they put forth are centered in community and the folks that they are representing. Right? Like, what statements are they making about various court cases that are impacting women, Black women, and the community at large? And truly just making sure that, are they having those conversations with the people that they need to have those conversations with? Not just their corporate donors, but are they staying rooted in the people that actually are getting them to where they need to be?
Right.
And what that looks like. And so I do think that there is a level of accountability that we have to put on them to ensure that they remain rooted in the cause. Because I do think that sometimes people can get caught up in just making sure that a piece of legislation gets passed and compromising on key things that we need to ensure that our communities are safe. And so that requires us to keep them accountable.
We want to make sure that we can keep our folks in office. And a lot of that, there are multiple pressures with folks who are trying to figure things out, and there are multiple factors in elections. And so I think it is incredibly important for us to not only have their back when they are doing great things, talking about the champion work, making sure that people understand that, and communicating that back out to our folks, our partners, our members, our base. We also need to build the political power to keep them in power. So that means that the operations of elections is incredibly important. That means us trying to raise the money is incredibly important. Yes, that $10, if you got it, that matters. to giving into our elected officials. Very oftentimes that we try to not only endorse, but to give a little something on it. And if we can, try to figure out like who do we know, who do we need trying to bolster out if they need either some help knocking doors or if they need some help just on resources.
I served in the Michigan legislature for 4 years. And what that meant for my community was they had someone that was young, that had grew up in the community, that knew the community I was serving, and I could advocate for the community. And I had the pleasure of serving on the Judiciary Committee, and I got 5 bills passed into law while serving. And I live in Michigan. I was in the minority party. And that took an immense amount of work, but I think about, how much it took for me to get there as far as voting, which, everybody should earn their vote. But we have to be really vigilant and do our research about who we are voting for. And I know that a lot of people, even now, I'm up for election now, but they'll get a piece of literature in the mail and they're like, okay, they believe in these things. Okay, cool. But is the person going to do the extra mile to make sure that bills are passed or appropriations are coming back to your community?
It was election night 2016.
Oh, that one.
Yeah, that one. And we were having a watch party at the office, and you can imagine how the energy went from like 100 to 0. Mm-hmm. And it became, okay, what are we going to do?
Yes.
We're going to have to do something. And that's when Reecie was like, we're starting to C4. So we can tell people how to vote, what to vote, et cetera, as opposed to make strong suggestions or frame it in language. So one of the things that elders need to do or mamas need to do is get out the way.
Oh, okay. Okay.
Right? So
not an extra enthusiastic hand clap. We have an amen in the audience.
One of the things I always say is build relationships before you need them. Right? So when you're building relationships before you need them, some of the people that you build relationships with will run for office. Start there with them in terms of building those relationships, and then maintain and nurture those relationships. So well before the primary, get folks in the pipeline to be your candidate.
There's got to be buy-in by our providers, that Black women and historically marginalized and historically minoritized communities become the standard. And the thing is, a lot of times there's a conversation that has to be had about whether or not women in particular feel safe and feel like their institutions where they're presenting for care is a trustworthy institution, as opposed to saying women, especially Black women, have an issue with trust. That puts the onus on them. We're really talking about, when we're discussing standard of care, how trustworthy is the institution itself, and how does the institution pursue its patients, right?
What I see in the health equity space is language matters. So, we talk about health equity, we talk about the social determinants of health, we talk about political and economic determinants of health. Honestly, nobody knows what you're talking about. Given any room, if you say, what's health equity, however many people are in the room, you'll get that many different definitions. And so what has happened over time, going back 40 years when the very first health equity report was published, is health equity became this thing of comparing people who aren't white to people who are white. That was, so it was like, well, if Black people, I'll just simplify it, could have the same health as white people, then we have health equity. That nothing could be further from the truth. So leaders have to actually use language that makes sense, that actually accurately describes the situation. And so this is where data comes in. I'm an epidemiologist, so I'm always going to talk about data. Leaders can use data to actually clarify or confuse people, as we know. So a great example is breast cancer mortality in Black women. Everybody in this room has heard the statistic, Black women die 42% more from breast cancers compared to white women. So the language leads people to believe, it's because they're Black. When in fact, we know if a white woman and a black woman have the exact same breast cancer, get the exact same treatment, they will have the exact same outcomes. There is nothing about being a black woman that causes her to die more from breast cancer except lack of access to early detection, lack of access to the standard of care of treatment, lack of access to quality follow-up. That's it. So when leaders start using data that actually tells the story and puts things in context, and then stop comparing non-white people to white people, because again, let's look at maternal health. The US is dead last among developed countries in maternal health. So if we're talking about health equity, then we're telling black women, well, let's aspire to be last. That is not the message. And the Black Women's Health Imperative has been, for a very long time, using data to tell stories. We've got Lisa Cunningham, we've got our policy folks, to put, with Dr. Epps, to put the story and data in the context of action. Like, here's what health outcomes for black women can look like. Here's what our lives would look like if racism and gender discrimination and economic oppression didn't dictate what we had access to, because we would make the choices we could make to be as healthy as possible. We know that, and the only reason it's not happening is because these systems prevent it from happening, which I am a broken record on that. But when it comes to leadership and language, we have to use language that makes sense, and we have to use language that helps people to understand their role. So everybody who knows me knows I'm fond of saying, I may not be able to make you do anything, but I can cure ignorance. And you are not going to walk away from me saying, well, I had no idea. You're going to know, and then what you do after that is up to you.
I mean, we understand as organizers and activists, this frontline work is not just difficult because it's labor intensive. It is made more difficult by the racism. It is made more difficult by the sexism. It is made more difficult by the loneliness of being in the front of said line. It is made more difficult by the fact that oftentimes they are sort of being broadly attacked because there is an accountability stand on business, but we have champions that are standing inside of there that sort of get swept up in the anger. So we need to be very specific about who we're talking about. We need to single out our folks who are in the fight on our behalf and lift up those champions, just as we are going and asking them for things, thanking them for things, but also just being a presence. I have we go down to the hyperlocal level.
Yeah.
And so you will understand that there are a lot of radical extremists who will show up to those meetings. And oftentimes, I think this is the same in the church as well. I don't know, but you know.
Why is church here?
It's just organized spaces. Sometimes we need to make sure that those of us who may not always, love the energy that comes in a conflict space, we kind of have to push ourselves past that, because we are leaving our people there to have to fight a lot of high energy people who don't mind conflict at all. They have come to bring it. Yes. And they are there and they are wondering, where are their people? Where are the allies? Where are folks to just be a physical presence in the chamber and make me feel safer? They want to see a friendly face, I just want to snap in the back. Something, because they're getting paid peanuts, folks. These folks are in their earning years and giving that up for this public service life. And so remembering a lot of the sacrifice that, yes, with great power comes great responsibility. And this is a communal act. I'm going to lean on what Sister Latasha was trying to remind us about, the unique way in which we, as folks of color, have originally started in the way of even our politics, our villages, the way we live. And there's not this big separation. It's a circle. And so recognizing that we need to help feed and water with good information and resources from the organizations, I do think it is important to push people. But I think that recognizing that first and foremost, they may need a little grace, because it may be an education gap rather than an intentionality to leave behind the folks who supported them.
There are successes. The problem is it's hard to take them to scale because the nonprofit business model is find people who are aligned with your mission and vision, who have money, who can support you, and that works great so long as they're aligned. But then when things change and they're no longer aligned with your mission and vision, they're then giving money someplace else. So, it is, for nonprofit people, we've got to figure out a way to not only have the programs that are successful, but take them to scale so they so they continue. So the Black Women's Health Imperative, when I first started, we had a diabetes prevention program. CDC funded us because they have this national diabetes prevention program, and we were a grantee and we did it. And I was sort of that voice and Valerie Rochester was there at the time. I was that voice saying, how is this working? How are we doing this? And over time, what we did, and I know Valerie got tired of me saying that, but over time, what we did is we figured out how to take diabetes prevention and incorporate it into Black women's lives the way they actually live. That's right. Not the way the people who were part of the study at CDC lived. That's right. So, very long story short, CDC asked us to rewrite their curriculum, which we did, for Black women, for Black men, for Latinos, for the general population, because our model worked so well. Our statistics were far better than anybody else who was doing the program, and they continue to be. We are the leader. Now the question is, how do you take a program that works at preventing diabetes and heart disease and obesity-related conditions to 86 million people? Because CDC says, well, here's your $1 million. Like, you can't reach 86 million people on $1 million or $10 million, but it works. So that is one. If we could just do that, then imagine the impact we would have on Black women's lives, not just every day, but Black women who are giving birth. Now we're talking about gestational diabetes not happening. Now we're talking about all of the maternal morbidity issues not happening. The Preventive Services Task Force, long time ago, 2009, 2015, said, we're going to raise the age of screening mammography from 40 to 50. In 2016, I was in 30 meetings. In 29 of them, I was the only Black person in the room saying, no, that's not a good idea. And these people, including my former American Cancer Society colleagues, said, oh, but Linda, we've got the data and the evidence. So I stood up in front of this group and said, yes, you do have data and evidence. These studies were done in Sweden and Canada. There were no Black women in them. If we know Black women get breast cancer 5 to 7 years younger than white women, why would we wait to start looking for breast cancer? And two things were important. If that happened, then by statute, insurance companies wouldn't have paid for mammography under 50, and another 1,300 Black women would have died every year. We got the legislation passed, and finally the Preventive Services Task Force just said, we're going to keep screening at age 40. There needs to be corporate and philanthropic partners who are willing to listen. Because we all know the experience of the funder gives you the money and then proceeds to tell you how to do the work when they have no idea what they're talking about. So the way we're going to get this done is to have those partners who will listen and policymakers who don't look like the community who will listen. Yes, we need to do all the other work of increasing representation, but we don't have that much time. Now, the thing that concerns me is, on a positive side, the demographics of not only the U.S., but the country are changing. The average child born now is not white. So in another 20 years, the average voter will be something other than white. What concerns me is if we don't start this work now, then in 20 years, we could look like South Africa of the 80s. And we can't have that kind of misalignment of power because then everybody in this room suffers. Our children, our grandchildren will suffer, and we can't have that. So it is possible, but it's going to take, frankly, leaders who have the ovaries to stand up and do what's right.
Yes. That's right. I'll just call this your V strategy. One, what is your vision? Have you ever envisioned what would America look like without racism? Have you ever even asked yourself that question, right? And if you've not asked yourself that question, it will never come to be, right? And so it's important because there's nothing that's ever manifested in the physical realm that wasn't first envisioned. So you need to be answering that question every single day of what it looks like. So then that moves you to the next thing. How are you using your voice in this moment Are you going, like literally it's fine for us to talk about what those folks gonna do, but we gotta change it. If we waited on folks to create some stuff, y'all, we'll still be on a plantation somewhere, right? We've always had to chart our course a certain kind of way. The third thing is I think it's really important for you to shift your paradigm of what we see as a victory. That it is okay for us to keep trying and experimenting, that even sometimes in nonprofit organizations, they judge us by, oh, we want success after success. No, what you realize is that part of success is from trial and error. We know this. And so we've got to make sure that when our communities, those folks that have been in our communities and those doctors, those programs, that we're constantly saying their name. Oh, this is who helps me. This is the folks, right, that we're advocating for that. And the fourth and the final thing, it is important to vote. It's not, I don't think that voting is going to be the end all and the be all, but ultimately that there are a couple of things. That one, that we've got to vote and put people in office that have some kind of understanding so that we can push. And so it's really important to get in position next year, to get ourselves ready, get ourselves prepared, get ourselves prayed up, and get in position.
All right now. And that's it. That's a word, a sermon. That's a mic drop. I would like to thank you, ladies.